There is a code buried in your medical file that quietly predicts whether you are more likely to have a stroke, bleed uncontrollably, lose your memory, or develop cancer. It has nothing to do with your cholesterol, nothing to do with your weight. It is your blood type. Most people treat it like a fun fact, something you mention at a blood drive and never think about again. But researchers tracking hundreds of thousands of patients over decades discovered something that should have made front-page news. Your blood type is not just a label. It is a biological instruction manual your body has been running since before you were born. And depending on which type you carry, that manual contains some terrifying chapters. Before we get into your specific type, you need to understand one thing, or the rest of this will not land properly. On the surface of every red blood cell in your body, there are tiny molecular structures called antigens. Think of them like flags. Type A flies the A flag. Type B flies the B flag. Type AB flies both. And Type O flies no flag at all. Here is where it gets dangerous. Bacteria and viruses have spent millions of years evolving to recognize these flags. Some pathogens have hooks that fit specific flags perfectly. When they find their match on your blood cells, they do not knock. They just walk in. Your blood type is an active vulnerability map. And your clotting chemistry, how fast or slow your blood seals a wound, is directly linked to which antigens you carry. Now let's talk about what that means for you. If you are type O, you have probably heard you are the universal donor, the generous hero of the blood bank. That part is true. But here is what nobody mentions. Because type O carries no antigens, it also produces significantly lower levels of a clotting protein called von Willebrand factor, the biological adhesive that helps seal wounds and stop bleeding. In everyday life, this seems harmless, but in a serious accident or during major surgery, type O patients bleed harder and longer. Trauma surgeons have noted this pattern so consistently that some report guessing a patient's blood type just by watching the bleeding on the table. But the more immediate threat for type O is not trauma. It is your gut. Type O blood cells display a structure called the H antigen, and it acts like a docking station for specific pathogens, including the bacteria responsible for stomach ulcers and the viruses behind severe gastroenteritis. Type O, individuals are measurably more susceptible to these infections. Not because their immune systems are weaker, but because their gut lining is a more compatible surface for these invaders to attach to. If you are type O, protect your stomach acid. It is your first line of defense. Avoid overusing antacids. If you have recurring stomach discomfort, get screened for H. pylori early. And before any surgery, make sure your medical team knows your blood type in advance. Now flip the script entirely. Where type O blood is slippery, type A blood is sticky. And in a world where most of us sit for 8 hours a day, that stickiness is a serious problem. Type A individuals have elevated levels of clotting factors and naturally higher concentrations of fibrinogen, a protein that promotes clot formation. Research consistently links type A blood to higher rates of deep vein thrombosis, pulmonary embolism, and heart attack. But it gets darker. Large-scale epidemiological studies have also found a statistically significant association between type A blood and higher rates of gastric and pancreatic cancer. Researchers believe this runs through how the immune system handles inflammation. Type A individuals appear to create an internal environment where certain abnormal cells are less likely to be flagged and destroyed early. If you are type A, movement is not a lifestyle choice. It is medicine. Do not sit for more than 45 minutes without getting up. Manage stress seriously. Type A individuals also produce more cortisol, which further promotes clotting. And eat anti-inflammatory foods. Turmeric, garlic, omega-3s. For you, these are functional interventions, not wellness trends. Type B blood is carried by roughly 10% of the population, and it is often the most overlooked profile. But overlooked does not mean safe. Type B individuals show higher baseline levels of C-reactive protein, one of the body's primary markers for systemic inflammation. This is not about clotting like type A, and not about bleeding like type O. It is about slow, grinding damage to the vascular system over years, particularly in the peripheral arteries supplying the hands and feet. If your hands are always cold for no clear reason, that may not be a quirk. That may be early vascular inflammation. Type B individuals are also measurably more susceptible to foodborne pathogens in undercooked poultry and eggs. The B antigen provides a more compatible surface for these bacteria to anchor, making infections both more likely and more severe. Watch for numbness or persistent coldness in your extremities. Be meticulous about food safety, and eat nitric oxide-rich foods. Beets, leafy greens, citrus, which help relax and open blood vessels. Less than 4% of people carry AB positive blood, and a major study published in the journal Neurology, tracking tens of thousands of people over years, found something alarming buried in that small group. A B blood type was associated with significantly higher rates of cognitive impairment and memory decline compared to every other blood type. The mechanism appears to involve the tiny capillaries that deliver oxygen to individual clusters of neurons. AB individuals carry elevated clotting tendencies from both the A and B profiles combined. Over decades, this can create sluggish flow through these microscopic channels, slowly starving brain tissue of the oxygen it needs to stay sharp. This does not mean AB blood causes dementia, but the association is documented and real. Control your blood pressure. Even modest elevations accelerate this microvascular damage. Exercise regularly, not for aesthetics, but to push circulation into those tiny brain capillaries. Your cardiovascular health is your neurological insurance. If your blood type has a negative sign, you belong to a group making up only about 15% of the human population. What makes you different is the absence of the Rh factor, a protein that sits on the surface of blood cells in Rh-positive individuals. And that absence creates two serious risks. The first is reproductive. If an Rh-negative woman carries an Rh-positive baby, her immune system can identify the baby's blood as foreign. In subsequent pregnancies, this immune response can escalate and damage the fetus's red blood cells. The medical intervention, an Rh immunoglobulin injection, is highly effective, but only if the conversation happens with your doctor early. Never assume it will come up. Bring it up yourself. The second risk is supply scarcity. O-negative blood can be given to anyone. Hospitals always need it and always run low on it. But if you are O-negative, you can only receive O-negative blood, which exists in less than 7% of the population. In a mass casualty event, in a rural hospital, during a complicated surgery, the supply of your specific blood type may simply not be there. If you are any negative blood type, consider wearing a medical ID that includes your blood type. Know which hospitals near you maintain larger blood banks. And if you are facing planned surgery, ask about autologous donation, banking your own blood in advance so it is available if you need it. A B negative is the rarest of all, found in less than 1% of the population. The complexity of AB combined with the scarcity of the negative Rh factor creates the most difficult supply situation of any blood type. Knowing your family members' blood types is not just interesting information. It could one day be medically critical. Here is the single most important takeaway. Your blood type is not a fun fact. It is a biological signature that shapes your specific risk profile for infection, for clotting, for heart disease, for cognitive decline. Type O, protect your gut and brief your surgical team. Type A, move constantly and fight inflammation. Type B, watch your circulation and your food safety. Type A, B, cardiovascular health is brain protection. Any negative type, know your supply constraints and plan ahead. Medicine treats populations. But you are not a population, you are a specific machine, running a specific blueprint, carrying specific risks. Now you have part of the manual.